Good afternoon, everybody. The NHS has had an ambition to deliver care in completely smoke-free environments since the 1980s because of the mounting evidence that smoking and passive smoking shortens your life expectancy. But it took 20 years for the NHS to become partly smoke-free when in 2006 smoking was no longer allowed in hospital buildings. And that created a new problem for mental health settings as smoking moved out of the smoking room and into designated areas in ward gardens and hospital grounds. And then we had the situation where care became organised not just around medication times and meal times, but around smoking breaks, when patients were escorted into ward gardens to smoke several times a day in a relatively short period of time. And we looked at the impact of this in SLAM on 25 wards and found that staff were facilitating around 7 breaks a day, spending around 2.5 hours every day on every ward supervising smoking. And that was at an opportunity cost of up to £83,000 per ward per year, depending on who was doing the facilitating. And in 2013, the Department of Health and NICE recommended that hospitals should be smoke-free inside, but also in the hospital grounds. And there should be no more facilitated smoking breaks. But more importantly, they also recommended that patients who smoke should be offered treatment once they're in hospital. And SLAM were one of the first mental health trusts to go completely smoke-free in 2014, following a successful pilot in the forensic services led by Mary Yates. And staff in the addictions department worked together with SLAM staff to get the balance right between treating tobacco dependence whilst maintaining a smoke-free site. And we did that through a number of means, but also we looked at what were the barriers to implementing smoke-free policies. And one of the pieces of work we did was to look at physical violence in relation to smoke-free policies, because staff were telling us when we were doing our listening exercises that their biggest concern was that if we take away smoking breaks, violence would increase. So we looked at violence over a 42-month period, and this was 30 months before the implementation of the smoke-free policy and 12 months after. And we looked at violence towards staff and violence towards other patients. And there was about 4,500 physical assaults on staff and patients over a 42-month period. But when we did the time series analysis and we checked and triple-checked and quadruple-checked the data, we found that there was an overall 39% reduction in violence towards staff and other patients, a greater reduction in violence towards staff members than patients. So smoke-free policies, they're certainly not without their challenges, and it's one of the most challenging things I've ever done in my mental health nursing career. But what we've also found with the work that we've done with SLAM is that patient care improves. So the identification of smoking status and the recording of that in clinical notes, which is the very first part of the treatment pathway, that's improved greatly. That's gone from 11% when we researched this in 2011 up to 91% today. And more people than ever before are receiving treatment whilst they're in inpatient units. So that treatment involves nicotine replacement therapy, it might involve e-cigarettes, and that's gone up to 60% from 17%. And what we're finding, it's the people with the poorest health and social functioning that are agreeing to take up the offer of support. So this is Earl and Francis, who have agreed to share their stories and pictures today. And this is them celebrating being smoke-free with Mary Yates, who leads on this in SLAM. And we've got countless stories of patients taking control of their smoking at what is one of the most difficult and challenging times of their lives, when they're an inpatient unit or receiving care in the community. And I'm very grateful for King's for giving me the opportunity to be part of SLAM's smoke-free journey. Thank you very much.